Congratulations to the Impact on your 1-year anniversary. I think your team and your dedication and what you guys stand for and your innovative model of care is truly an inspiration to all of us here in Unity Point Clinic. We couldn't be more proud of the work you're doing, the impact that you guys are having on our patients every single day through the transitions of care, the accessibility in the post-acute services, and then reducing readmissions, really championing excellence and seizing that opportunity. So keep up the good work and looking forward to seeing what our accomplishments are in the future.
I'm Bonnie Henry, the Director of Nursing at Harmony House Healthcare Center in Waterloo. I'm here discussing the Impact team and what an asset they are to our facility. They answer phone calls whenever we call. One of the nurse practitioners will come out to the facility and see an acutely ill patient. They also come out and do rounds, which is nice for our residents not have to leave the facility. They were also willing to the nurse practitioners were willing to take more acutely ill patients that other practitioners in the area would not. So thank you very much.
I'm Kaylin Bogie-Kleiss, Clinical RN and Team Lead. I get to do a lot of the background logistical support for our providers within Impact. I also get to be a master care coordinator and a patient advocate for all of our patients so no one falls through the cracks. I love all the process improvement that's happening between the hospital, Impact, the post-acute settings, and the clinics to better serve our patients in the Cedar Valley. Program development and data analysis is a passion of mine within Impact. I love seeing the impact that Impact makes on our patients and makes it the best place to receive health care.
I'm Michelle Friedman, the team lead for the Unity Point Clinic Impact team. Our team has really worked to fill that niche for that patient care for those population of patients that live in the nursing facilities. So either they're there for long-term care or they're there for a skilled stay. In either case, these patients previously had a hardship to get out of the facility and go see their providers. We're able to deliver that care right to the bedside. A lot of the work that we do, it's compassionate care right at the bedside with those patients, and we work closely with other Unity Point entities to coordinate their care. I like to think that Impact is really delivering on that brand promise for care coordination.
Impact team, we, as part of Care Initiatives, want to reach out and say thank you so much for all the work that you do. We love the model. The work that you do with care at the patient bedside is fantastic for our patients. You well know, we're no longer moving our patients to where they have to go. We're coming to them and taking care of them in place. We're filling just necessary gaps in coverage of providers and just continue to wish that we can replicate what you do in many other places. And you should know we tout the Waterloo market and what you guys are doing with Impact all over the state and implore our other markets to start adopting a process much like you guys have. So we're thankful for the work that you do. You guys provide great care on behalf of Care Initiatives, Northcrest, Ravenwood, and now Pinnacle. We're excited and continue to be excited to work with you guys hand in hand. So thank you very much and congratulations on 1 year.
Before we had Impact, we used to really struggle with the nursing home patients. There are some of the points I would like to bring up. One was the coordination of care, not just for people who are in the nursing home, but also patients who are discharged from the nursing home. The biggest difficulty that we used to face is the paperwork and lack of care coordination. Giving you an example, patient is discharged from the hospital, let's say around 12 o'clock, and we used to get a call from the nursing home with the paperwork stating that, asking us questions about the antibiotics, about their stay, and we were completely clueless, and it was a lot of frustration. The second frustration that had arose at that time was, people who were discharged from the hospital, and the nurses would call us with some questions. Sometimes these patients are admitted with shortness of breath. They're getting better, but the nurses then call us, hey, patient is short of breath, what should we do? A usual knee-jerk response from any of the providers would be send the patient to the ER. since Impact has come, and again, you just shared the numbers with me, the readmission rate was 17% before, and now for our clinic itself, it's only 9.5%. I do believe Michelle has done a wonderful job. I personally know a couple of instances where she has definitely stopped in admission, and I know those patients very well. They're doing really well. They appreciate Michelle. Patients who have been under Impact, they really like Michelle. They were really frustrated before because of the lack of care coordination, and now they feel that they are getting really good care. So this was about patients who were being discharged from the hospital into the nursing home.
I'm super excited to be a part of Impact. I cannot believe that it's been 1 year already. From a hospital standpoint, we are doing a lot of good work, and we bring standardization, improvement in quality, even in the nursing facilities. And from a hospital standpoint, we are already seeing a reduction in rehospitalizations, and I think that is excellent.
Healthcare is provided not only in the hospital, but outside the hospital walls. The Impact team is involved with providing care for patients outside of the hospital, the transition of healthcare into the skilled nursing settings in the nursing facilities. It is all about making sure the patients are receiving the quality of care that they need and deserve once they leave the hospital, making them very successful in their care and their ability to remain outside the hospital feeling well.
Working with the Impact team has been a very positive experience. They go up and beyond to ensure the residents and family needs are met to the best of their ability, not only at Northcrest, but other facilities in the Cedar Valley area. They are professional and knowledgeable about those they serve. We are very privileged to have them a part of our team as they always go the extra mile. Thank you, Impact team.
I just want to say thank you to this entire Impact team for all of the work that has happened already, and I'm so excited for all of the work yet to come. I remember 3 or 4 years ago, Michelle Friedman and I sitting in the cafeteria concocting this idea of caring for our patients outside of the hospital, and now it's a reality, and we're doing exactly what we wanted to do. Care coordination is Unity Point Health's brand promise, and this team is delivering on exactly that. So kudos to all of you. Congratulations on your 1-year anniversary. Looking forward to many more years to come.
I'm Sarah Krugo, Impact RN. I get to come to work every day and elevate the care services our nursing home population receives. I get to be a master coordinator, triage, and keep the service running smoothly. I work with the best providers there are. Impact is making an impact for patients every day with the level of individualized care and support they and their family receives.
I'm Sue, and I joined the Impact team in March of this year, and I feel very privileged to be a part of this innovative care delivery. It is so nice to be able to build relationships with patients and their families. We follow them into the skilled nursing and even the long-term care environments. We help to collaborate with specialists to provide the care that these patients need. And I really feel like it's a great example of the point of unity. The point of unity is our patients.
I wanted to share with you our experience when we had a positive impact with the Impact program. Instead of having 5 to 6 doctors coordinate the best care for our mother, we had someone that we could turn to and advise us what was truly necessary. To have medical care on site available after hours was extremely comforting and helpful. Michelle was accessible, responsive, and on top of her mother's care. She was the one constant for us that on our mother's condition that was constantly changing. It not only gave us a peace of mind, but I believe it helped my mother by eliminating unnecessary trips outside. The Impact program was able to give us comprehensive assessment for our mother's health situation, not bits and pieces.
Happy anniversary to our Impact team. From a care coordination perspective, we value the Impact team for our ability to hand our patients off to someone we know and trust to continue our plan of care and take care of our Unity Point patients. The Impact team also helps us by reducing our readmission rate and increasing our quality initiatives. We hope to continue working with them across the continuum for our patients and do even better work in the future. Happy anniversary.
I first met Impact when I met with Dr. Sandpat and was concerned how I was going to become involved again with Allen Hospital. I am delighted with the experiences I've had with Impact. Michelle has followed us through 3 institutions. She always listened to me, which I really appreciated, and she always took care of the problems. I was told at one of the institutions that my husband was very fortunate because he was so closely followed by Impact, much more so than any of the other residents. One night, I was called about a medicine change because the director of that particular institution wanted it changed. I told him to call Michelle. Michelle said absolutely not. And so our experience there was just very reassuring to us that she was really following through. She followed me and my husband through 3 different agencies. She was always there for us. Impact always answered all of the phone calls that I made, and never once did they fail to follow through with whatever problem existed. I highly recommend Impact and the people that work there. I'm particularly delighted with Michelle because she was so good to us and followed through so carefully. I would recommend it to anyone. It is a marvelous program.
In this dynamic world of healthcare, innovation and process improvement are at the forefront. I feel privileged to be part of this high reliability team. Each of us bring a unique skill set that makes our team so complete and strong. We are bringing a change that everyone would wish to see by addressing the acute care needs and reducing the readmission rates. Please continue to support and encourage us while we revolutionize healthcare in the post-acute arena. Thank you. Kudos Impact.